Welcome to the Cannon Falls Library How-To series. Today we're going to talk about a subject that a lot of people ask us about, and it's breathing. And you may think that a how-to video on breathing is a little odd because that should be something that's self-explanatory, and after all, if there are about 8 billion of us around the world, it's because we've figured out how to breathe most of the time. But there are a lot of factors of modern life that contribute to poor or inadequate breathing, and so today we want to talk about how to optimize breathing and get the most oxygen in your system. First, we're going to do a quick anatomy review about breathing. Your trunk is separated in two parts by a large dome-shaped flat muscle called the diaphragm. The diaphragm separates the chest cavity, which has your lungs and heart, from the abdominal cavity that has all of your bowel contents. When you breathe, this muscle contracts and it flattens and depresses so that it makes the lungs bigger, and it allows the lungs to what we call inflate and take in oxygen. When you breathe out, that flat muscle relaxes and comes back in an up position, and what it does is it pushes the stale air out of your lungs. Now, there are other muscles that are involved in breathing. They are called accessory muscles. The accessory muscles that are responsible for breathing in are in your neck, your chest, and a little bit in your shoulders. So if you have to take a really deep breath in, they can help that. And the accessory muscles that help you breathe out the air are primarily in your abdominals. And so what they do is they push in and they help lift up the diaphragm to get rid of the air in the lungs. Now, before we talk into the specifics of breathing, I want to use an analogy that's not anatomically exact, but I think it's going to help you recruit the right part of your body to get the most oxygen. We're going to talk about this area of our trunk as being the small oxygen tank. So it's an oxygen tank. We can certainly breathe out of it. But we're going to talk about the abdomen as being the bigger oxygen tank, and we're going to try to use the bigger tank to get most oxygen. Another thing you want to remember is that if you want to maximize the amount of space to bring in oxygen in your upper or lower trunk, you can't be in a slouch position. That's going to decrease the availability of oxygen. So when you want to practice breathing, one of the very first simple things you need to do is just make yourself tall and relaxed. The other thing about breathing is that in order to make room in your lower oxygen tank, you have to learn to relax your abdomen. And we do live in a culture where a flat stomach is what most people aspire to. So very often we achieve that by unnecessarily tightening your abdominal muscles. A little bit of tightening is good for the stability of your lower back, but it also can prevent you from taking a normal breath through your big oxygen tank. So we have to learn to create a little bit of normal relaxation of the stomach to breathe the best that you can. The very first thing that we want to learn to do if we want to optimize our breathing is actually not to learn to breathe in. Most people actually have a hard time learning to breathe out, and so if you cannot fully empty out your lung, you actually can get rid of the stale air to bring in fresh air in your lungs. So we're going to talk first about how we learn to breathe out, because, and that may be a surprise for most people, that's the part that's often missing. And I'm going to give you 3 different options. The first one is very simply to breathe in on a count of 2 and then breathe out on a count of 3. So you're going to spend intentionally a little more time breathing out than breathing in. So here's going to look. I'm going to breathe in through my nose on a count of 2, and I'm going to time with this hand. And I'm going to breathe out on a count of 3, which I'm going to time with this hand. So this is what it's going to look like. So hopefully that first exercise was pretty easy. If you got 2 hands and you can count to 5, you should be able to do that. Actually, if you only can count to 3, you can even do that. So the next thing we can do, tall relaxed position, is we're going to learn to fully empty out our lungs and our abdominal tank by recruiting the accessory muscles of expiration, which are going to be your abdominals. Very simply, what you can do is, in this position, after you breathe in, you're going to push your belly button, focus on pushing your belly button, squeezing your abdominal muscles into your belly as much as you can when you breathe out, and take a normal breath in. This is what it's going to look like. I'm going to do it from the side, so you can see that a little bit different from a different angle. The third exercise about breathing out we're going to do is called a balloon exercise, and some of you who've been at the office, you've seen this, you're familiar with it. So we're going to use just a regular party balloon. We're going to take a normal breath in, and then we're going to breathe out 3 times, and we're going to not breathe in between the 3 times, and every time we're going to push out a little more air. When we get to the bottom of the breath, we're going to hold it a little bit until we have a very strong urge to breathe, and then we're going to release our normal breathing in. This is what it's going to look like. You take a breath of rest, and then you do it again. Now, one thing that I maybe didn't do quite right on the second one is you want to try to have every one of your 3 breaths to be about the same size. So you don't want to breathe out everything the first time that you breathe out. I'm going to do it one last time, better. And then you rest. This is an exercise you can do several times during the day. It's easy enough to have a balloon with you at your desk, for example, but I don't recommend you do it more than 3 times in a row, so you don't get lightheaded. And when you first start out, and especially if you have some breathing difficulties, you probably only want to do it a couple of times. So now we've talked a little bit about what it's like to breathe out correctly, to empty out the lungs, and now we're ready to put some fresh air in the lungs. We're going to talk about some strategies and some tips to really learn to breathe in fully. As we talked earlier in the video, we want to learn to shift our breathing from the small oxygen tank to the bigger oxygen tank. And then that's often not an instinctive way of breathing for us as adults. If you see babies, you'll see they breathe out of their bellies, but somehow, especially with stress and poor posture, that's something that we unlearn, that we have to find again. So have patience with yourself, because sometimes it's a little harder to find. The very first thing, if you recall, we want to make sure that we have a big tank by being tall and having our stomach relaxed. I'm going to invite you next to just close your eyes, be totally relaxed, and when you breathe in, just see if you can feel your little Buddha belly expand a little bit. Okay? So I'm going to try to find my Buddha belly. We just had lunch, so it should not be too hard. So I'm going to breathe out, and then now sometimes if you're not sure if you're really using your abdomen, you can do the following thing. You're going to put your hands just about your hips bone and below your rib cage, which is part of the smaller oxygen tank, right into your waist. And you're going to squeeze in, not to the point of pain, but to the point you have some pressure. and you're going to close your eyes, and when you breathe in, you're going to focus of with your breath pushing your hands away from each other, and you're going to achieve that by expanding your abdomen. It's going to look like this, tall and relaxed. Going to breathe out. So I'm going to give you one other little trick or exercise to try to find the deep abdominal breathing. And for this one, I'm going to be laying on my back, and so I'm going to walk you through that so it's not so hard for me to talk to you when I'm laying on my back. You're going to need some props for that one. You need something that's heavy enough, anywhere from 5 to 8 pounds or so. And having a flat base, like one of Dr. Alvarez's wonderful study books that she's been going through recently. And we're going to put that weight right on our abdomen. And what we're going to be doing is, as we breathe in, we're going to lift the book and the weight with our breath, which is going to require us to really engage all of the muscles that are breathing in into the abdomen, and then relax. And we'll know that we're recruiting our abdomen because visually you're going to see the book and the weight lift up. It's going to look like this. I'm going to put the weight on top of the book, and I'm going to put my hands behind my neck so I can see what's going on. You can also use a little pillow. And I'm going to breathe out. And then again, you probably don't want to do this more than 3 or 4 times in a row so that you don't get dizzy. So I hope that some of these tips have been informational. There was one last question that comes up sometimes with patients, and I wanted to very quickly broach that. And that's the question of whether or not it's better to breathe through your nose or through your mouth. There are different schools of thoughts on that. I don't know that I have a very strong opinion one way or the other, but I will tell you that it's probably best as you practice your breathing exercise to breathe in through your nose and to breathe out through your mouth. And the reason for that is, as we mentioned earlier in the video, a lot of people are having a hard time first emptying their lungs. So if you breathe out through a bigger conduit of your mouth, you're more likely to be actually efficient at creating empty lungs that you can then refill when you take a breath in. So, you know, like I said, that's different schools of thought. See what works for you, but maybe try to practice breathing out with your mouth open. So I hope this very short intro to breathing has been somewhat informative. Now remember that breathing is automatic, but great optimal breathing does take some practice and some patience. And so give yourself a good 6 weeks to work on it, and have a great day.